Hi everyone, Satinder here again. Really nice to be with you all this afternoon, and I hope you're all keeping really well. Um, First thing I want to do is to mention the people who have contributed to the information evidence I've used for this podcast, which is about stress. Stress is something which we all have in our lives. It's actually really important for us to have a bit of stress from time to time. And we've all experienced it, I know. So the sources have come from Dr. Rangan Chatterjee, who's actually brought out a book recently called The Stress Solution, um, by various neuroscientists and physicians, including uh, Dr. Mitu Storoni, who is both a neurologist and a neuroscientist, and who's written a very good book if you like to know more about the evidence behind some of the principles of stress. And it's called Stress Proof. And she basically she looked at over 1,000 research papers uh, relating to stress, and drilled it all down, condensed it all down to bite-sized pieces of information in the book called Stress Proof. And there'll also be information which I've sourced from uh, meditation, mindfulness coaches, including the likes of Light Walker and Danny Freer. So to start with, William James, who's a famous American philosopher, said, "My experience is what I choose to attend to." And that is actually very true, because our perception of our world is individual to each of us. You'll see and you'll hear and feel a very different experience from this podcast than I will, and from your colleagues in different strokes and outside of different strokes. And depending on which cues we receive in life, they give rise to very individual stress reactions. And therefore, how you deal with your stress is very dependent on the individual and the receiving end of the stress. Now, 80% of our thoughts and our habits are the result, our thoughts and our perceptions are the results of habits that we pick up over the years and which become embedded. But like all habits, with some repetition and perseverance, these can be changed. So even if you have found that you are the victim of certain habits in terms of how it affects your thoughts and perceptions of the world, they can be changed. In medicine, we diagnose, we look at for symptoms, and the prescription is usually one size that fits all. How we prescribe advice and therapies should actually be driven by the context in which you as an individual live, how you think and how you perceive in your situation. But of course, that takes time. And one of the advantages of these podcasts is that I can afford you more time to what I could afford somebody in a 10-minute GP consultation. Now, regarding stress, you'll each of you benefit from different strategies on how to deal with your particular stress. And it will depend on how you live. It will depend on what you're affected by. So for some of you, your main issue that's resulting in stress could be a lack of movement or erratic movement or a poor diet. For others, it may be a disruption in your circadian rhythm, whether through working night shifts, having a dependent who means that your sleep is disrupted, or if you're a pilot flying across time zones from say Hong Kong to San Francisco, and going from basically flipping your day to night. You may also feel stress from social pressures, like feeling oppressed, or from being bullied, or feeling misunderstood, or being ignored. You can also get stress from perceived pressures, personal pressures, like a deep sense of not bettering yourself, that you're not pushing yourself as far as you wish you could, and that you therefore and thereby somehow lack self-efficacy. And self-efficacy, unlike self-esteem, is your sense of doing, of achieving goals, rather than a sense of being. And self-efficacy in itself will lead to a sense of self-worth and vice versa. So if, for example, when you've been doing your physiotherapy podcasts on a morning, I've noticed some of your comments about that sense of achievement when you've done something you've not previously been able to do, or where you've given it your best shot, even if you've been unsuccessful, and you've got feedback about how you might want to modify what you're doing. And that will be giving you a sense that you're doing something and that you're achieving a goal, which will be all feeding into your sense of self-worth and is extremely important in helping you to create the resilience you need to fight against stress. We all live in a stressful world, and we always have. But there's a different kind of stress that we're exposed to now. It's more around the fast pace of our lives and the huge amount of information which is coming in at us from all angles. From the moment we wake up, even before we get out of bed, we can be exposed to over 100 other people's points of view just by looking at our phone before we've even let our feet touch the floor. Right up until nighttime, the amount of information overload we're receiving is making it difficult to get into a routine and to effectively switch our brains off. 2,500 years ago, Buddhist monks created meditation and mindfulness, and that was partly developed for spiritual and religious reasons, but it was also largely used over the centuries to help combat stress. But there were two aspects of life which have fundamentally changed in recent times compared to our past, which are making it more difficult for us to deal with stress or to feel safe. And I will go on to those in a minute, but first I want to explain about the brain. Now, stress comes about as a result of our feeling a loss of control, of feeling unsafe. You'll remember I've talked about the autonomic nervous system, and this is the nervous system which isn't under our voluntary control, but it's very, very important in providing all the vital functions that go on quietly inside our bodies. Now, the autonomic nervous system is flexible. It allows us to respond immediately to a stressful situation, and it's made up of two components, the sympathetic and parasympathetic nervous system. And the sympathetic nervous system is, like I mentioned before, like the accelerator. It gets everything moving, it gets everything working and on high alert, so you can deal whatever the situation, the acute stressful situation is. So it's very important and it's very valuable. And then you have your parasympathetic nervous system, which once the sympathetic nervous system has died down, the stress has gone away, it allows the parasympathetic nervous system to become stimulated, and that then deals with all the vital functions of repairing the body, of maintaining the body, of keeping up of the upkeep of the body. So that's a very important part of the nervous system as well. And we used to know about stress as doctors, as healthcare practitioners, but it remained like a ghost in the room. Whilst we knew it existed, we couldn't really quantify it, we couldn't measure it. We didn't quite know how it was having an effect on us, but we knew it was. But so it remained a ghost. But now, with so much more research being done and so much evidence being accumulated, it's becoming the big elephant in the room. It's now recognised as being a contributing factor and a trigger for so many chronic diseases and mental health conditions. We can actually now measure changes in our autonomic nervous system through two things. One is, well, three, but two have more recently come about. One is heart rate variability, and that means that when you're under a lot of stress, your heart rate should and does increase. It pumps more, and it also pumps more forcibly. And this allows more blood and therefore more oxygen to get to your brain, to your vital organs that are going to help you deal and tackle with that stressful situation. And it's very important. When the stress is gone, what should happen is your heart rate should settle down quickly. And that doesn't always happen with chronic stress. So you'll find that even when you're not under stress, you remain with an underlying raised heartbeat or a heartbeat which never really comes down at all. So heart rate variability gives a very good indication about how responsive your autonomic nervous system is to events and how quickly it calms down. We also can measure our autonomic nervous system through our pupils now, and that's a very emerging area of research. And basically the changes in pupil diameter, and the pupil is that very small dark area at the center of the colored bit of your eye, as that either opens or closes, that determines how much of your sympathetic as opposed to your parasympathetic nervous system is being activated at that moment in time. And again, this is providing another very beautiful way of measuring our nervous system under different situations, and is therefore helping research in this field. Now, as I said, normally we should have an immediate response when there is stress, with our heart rate going up, our blood pressure going up, our breathing increasing, and inflammation being set up. But as I said, that should settle, and sometimes that doesn't settle, and it can have very dire consequences as a result. Our brain is a prediction machine. It tries to model the world into a predictable form. It uses the cues it receives in order to do this. It does this because otherwise the world remains a very unsafe place, an uncertain place, and we feel that loss of control. And you remember I mentioned earlier about how, everything we do when we feel under stress is about trying to bring everything back under our control, to feel the safety that we currently don't feel. So how our brain does that is it creates its own model of the world to try and keep us safe, and thereby to reduce that uncertainty and danger. So stress, as I say, is where we're presented with uncertainty and we're trying to bring the stressful response under our control, make us safe. But unfortunately, we can't or don't control that uncertainty. And that's when we become chronically stressed. And the reason that happens is because we've lost the art of knowing how to press the right buttons that can make us feel less stressed and that can make us feel safe and that can tell our brain that everything's back under control. It is difficult to bring the associated physical and psychological symptoms under control that come with being stressed, but you can do it. And I'll give you an analogy. Imagine you're playing a video game, and it's one of these games where you're driving the car, and every time you feel anxious, the car veers off the road and you completely lose control. No matter what you try and do with your controls, your game controls, you cannot get the car back on the road. So you realise that the only way that you can take control of the car is by reducing your anxiety levels. And you try and do that, and by accident, or maybe by design, you perhaps realise that if you try and put yourself in the present, in the moment, if you try and focus on your breathing so that it stops you focusing on all the anxieties you have, that you temporarily regain control of your car. And you think, okay, so that's sending feedback, which is telling me that I'm learning which are the right buttons I need to push in order to get my car back under control. And that's basically a way of learning how to reduce your anxiety and reduce your stress levels. And the kind of things you can do to push those buttons, one I've alluded to, which is breathing. So things like yoga and meditative breathing do help you to identify those buttons that will help to give you the feedback over time to control your autonomic and automatic functions in your body. There are other things you can do as well, and I'll come on to those. Now, I mentioned earlier about how we've always had stress in our lives, but there are two things that have always been certain in our lives, which because of modern living are no longer certainties and which have destabilized us in one way. The first of these is the fact that we no longer experience the inevitable natural cycle of the sun rising and the sun setting, because the sun can rise and the sun can set in modern times, but we still have our blue lights and we still have all our bright white lights. And so our brain, for all it knows, it's still daylight, and that creates uncertainty in the brain. And before we had sort of electricity and the means to power all this light after darkness fell, before that, when you had before artificial and blue light, receptors at the back of our eye would detect a fall in blue light, and that would trigger the brain into realizing that it was nighttime, and that would produce melatonin. And the melatonin that was subsequently produced overnight is actually a very natural anti-anxiety agent, which is effective as many anti-anxiety drugs that are taken. So it's a very useful and free source available in our bodies, melatonin. But because we keep smothering natural darkness, we are reducing our melatonin levels, and our anxiety levels are rising, and our brains are also confused because we're not giving them the routine that tells them it's now, we're coming into a night time, there's going to be less light falling at the back of your eye, therefore it will trigger your brain to say that, you know, you're entering night, you need to think about sleep, get the melatonin up, and just generally feel calmer. So the other thing that's changed in modern life is that we no longer move as much during the day with low to moderate intensity exercise. Instead, we have long spells of being sedentary with short bursts of activity, often very high intense activity. And every time we're active, though, we actually lower our cortisol levels. If you don't move much during the day, then you're accumulating levels of stress cortisol by the evening. You're also less alert, less creative, and paradoxically, you often feel more tired if you don't move much during the day. So it's not enough to say, well, okay, look, I'm really busy during the day, I've got loads of work to do, I have to sit, but I plan to go to the gym for an hour after I've finished everything, or do 30 minutes of exercise. That just isn't going to cut the mustard if you really want to improve your well-being and reduce your stress levels. You do really need to move regularly throughout the day. And you'll remember from my movement podcast last week, I did mention how there have been studies that have shown the benefits of light to moderate moving throughout the day over one session of high activity at the end of the day. And of course, the other thing to remember is that it's best if possible to get that movement in during daylight hours. And the morning is one of the best times to get your optimum movement in as well. Now, routine is so good for us. It creates certainty in our brain and it promotes better sleep. As I said, promoting things like melatonin and all the other things that are so good regarding sleep that I mentioned in my sleep podcast. Now, high intensity movement is good for us in the right context, as long as it's not concentrated into those short bursts I mentioned, with long periods of being sedentary in between. I mentioned in my movement podcast about the benefits of high intensity movement. It's great for self-efficacy, for a sense of feeling that you're pushing yourself, that you're doing something, a bit like you've expressed in your posts following the physio podcast you've been doing. And it's also been shown in animal studies to increase new cells in the hippocampus, which is the area of the brain that deals with memory. And it also increases plasticity in our prefrontal area as well, which is the area which is often affects our mood. Exercise also resists our response to stress. It makes us more resilient, and it protects us against neurodegenerative conditions like Alzheimer's disease and dementia, other dementias. It can, on the flip side, if you do it too much, like all day, every day, it can cause increased inflammation and leaky gut. You might remember I discussed leaky gut in the diet podcast. But there are so many benefits as well to exercising to excess, especially for these like top athletes who do the triathlons and the desert runs and so forth, and the Ironman challenges and women challenges. But there are a lot of benefits on top for them. Increases mitochondrial biogenesis, which you've heard me refer to before, which increases muscle cell energy, which basically just means you're packed with lots more Duracell batteries to run for longer during the day. And also more intense movement increases drainage of something called the lymphatic system, which is in your brain and helps to get rid of all that junk that's up there. It also helps to increase your REM, that's your dream sleep, by 10%, and it increases your melatonin at night. So exercise is another good thing to do. Now, too often I mentioned about how, as well as real stresses, our brains can also perceive stress without there being actual stress around. As you recall, 80% of our thoughts and our perceptions are from our habits. So it's useful to realise this, because you may find that you might be very worried about your stress levels, and your doctor's arranged cortisol levels and said, oh, your cortisol levels are fine. Well, just so you know, if you have perceived stress, then your cortisol levels may not be raised anyway. So they may remain normal, but you still very much are feeling and perceiving stress, and it's very much affecting you physiologically and mentally as well, psychologically as well. Now, the way you feel about yourself will also heighten stress. I talked earlier about how some of the stresses you can experience include feeling oppressed, of feeling ignored. So I'll give you an example of that. They've done studies where one group, they had two groups, one of whom had felt victimised in their work environment, and the other group don't feel victimised. They're quite happy in their work. They then injected both groups with a nasal spray which had been contaminated with the common cold virus, and there was a significantly greater number of the members in the group that had been victimised at work who developed the cold virus. In other words, the stress from feeling victimised, of feeling oppressed, increased their susceptibility to getting the common cold, even though both groups were exposed to the common cold virus. Basically their immune system was run down because of the stress. Now, stress is now recognised as a quantifiable and measurable condition. So, as I think I've already mentioned, and may not have, we used to think of stress as a ghost. We knew it existed, but we couldn't put our finger on it, couldn't quite measure it. But it is now, as I say, this big elephant in the room. It triggers so many conditions, including depression, autoimmune disease, diabetes, and many times when you see a relapse in a long-term condition, you can often draw a line between a recent stressful event that they've experienced and that relapse. And I've certainly seen that a lot when I was working in general practice. So there is an undeniable link between stress and worsening your symptoms. In fact, now when we are screening our patients, those who have long-term health conditions are often given a short questionnaire about their mood state. And I remember back in my very early days in general practice, learning that that if you have breast cancer, you are more likely to get a recurrence of breast cancer if you, following treatment, a successful treatment, if you carried on worrying excessively about the possibility of getting further breast cancer. Every ache and pain was a sign that you were getting breast cancer, that sort of thing, and it was resulting in lack of sleep. These women who fell into that category were significantly more likely to get relapses. So, going on to some techniques and how they help. Meditative breathing. It relaxes muscles, it releases tension, and it releases pressure. For example, with chronic pain is always made worse by the fact that because things hurt, you tighten yourself up. If you can learn to breathe in a meditative way, sort of deep, slow, repetitive breathing in a comfortable position, doesn't have to be cross-legged on the floor, it really doesn't matter, as long as you're comfortable, then people have been known to be able to come off their medication. And it has been used in people who perhaps struggle with the medication, don't want to be on painkillers. They have found that this is effective. And I remember reading an article in the National Geographic recently about pain, and there are people who, in America, with very, very intractable, unpleasant pain conditions, who found that deep breathing meditation did help them to deal with their pain. It was a bit like having Entonox, gas and air. You feel the pain still there, but you're less bothered by it, which is really, I suppose, what a lot of painkillers do. But the advantage of the deep breathing is that you don't get all the side effects of the stronger painkillers. They've also found that it reduces something called anxiety storms. So when you're having a real storm of brain activity leading to a crescendo anxiety, deep breathing can really bring the brain waves into a better pattern, which helps to dumb down that storm of anxious thoughts and feelings that are surging through your brain. And so deep breathing can be very useful in those situations. And they've compared it to vagal nerve stimulation, which is sometimes used to help where people are having epilepsy brainstorms. And they found that deep breathing had a very similar effect to the vagal nerve stimulators that are commonly used. Not commonly, but occasionally used. Mindfulness. This has been found to be as effective as many forms of antidepressants and anti-anxiety agents, especially where there is an issue of past abuse or past trauma. Mindfulness has been shown to be very useful. And all it is being able to put yourself in the present. So, for example, when we do our gardening therapy, run our gardening therapy groups, most of that is mindfulness because people are focused on their activity they're doing at that point in time. And for a short spell, they're distracted from all their past strifes, their future worries. That's called being in the present. And it's very important because our current lifestyle is such that we're so future driven. We're constantly thinking or worrying about the future. And we don't allow ourselves those contemplative moments where we are just grounded in the present time. It just isn't very fashionable to do that anymore, but it's so important for our brains. Our brains do these things because they know that it's a benefit for us. So we need to learn not to fight against what our brains really need and want in order to make us feel better. There's a wealth of evidence that shows that the positive physiological benefits of mindful activities. These include, as I said, just enjoying an activity or hobby that you can get deeply absorbed in, like the gardening that we do, yoga, mindful meditation, Tai Chi. All of these have been investigated and studied and known to demonstrate reduction in heart rate, blood pressure, and an improvement in the immune system, immune response, and also a reduced activation of the emotional brain centers in our brain, including the amygdala. And for those of you who may be troubled with emotional lability, and I know that's one of the boxes that's been ticked quite frequently in terms of follow-up podcasts after these finished. You may want to perhaps consider trying mindfulness or meditative breathing to help with that emotional ability, to help to to reduce the activation in those emotional brain centers. Diet. Research, I'll go straight into an example. Research split two groups of people, both of whom had major depression. And they split these two groups. They were both blinded, as were the researchers, which means that they not that they were made blind, but that they weren't aware of what they were taking in terms of its effects versus the other group. They were just being told to try, whatever it was, and they weren't told why. And one group was exposed to an improved diet where they reduced the amount of processed salts, sugars, fats, and they increased all the vegetables, the legumes, the grains, pulses, the healthy fibers, and they and drinking more water and so forth. And the other group had social support. Now, when they looked at the results, what they were measuring, and the people didn't know this, were measuring how their depression was. When they looked at the results, in the group that had been exposed to an improved diet, 30% of them had no longer any symptoms of depression. And remember, these are people who'd had major depression, and 30% of them, that's nearly 1 in 3, their mood improved to such a degree that they no longer had a diagnosis of depression. That was compared to 8%, I'll double check, 8% in this group that had just received social support, but with no change or improvement in the diet. And that was after 12 weeks, so not even that long. The next thing I want to come on to in terms of how we can help ourselves to handle and deal with stress: relax. We live on a very nervous planet. Matt Haig, famously, he's written some excellent books on the subject. One of them is called something about the nervous planet. And there's been a few books written on this subject that, as I alluded to earlier, before we even get out of bed in the morning, we can be exposed to 100 other people's points of view. We're constantly being bombarded with information from all quarters, and everything is done so quickly as well. We're more into volume rather than quality of everything we're reading and learning and being exposed to. And really, when I say relax, what I'm really asking you to do is to give yourself permission to relax. Now, that may seem fairly straightforward, but you'd be surprised how many people really don't know how to, and I'm included in that. We've lost our daily routine. We're constantly forward planning. We're measuring everything. We're competing not with just ourselves, but against others as well. We've been doing it since childhood. As soon as our children are out in nappies, they're being exam focused. They're told that these are the goals you have to achieve, that to get to the next goal. But we're losing the joy of learning for learning's sake, rather than always being driven by targets and numbers. And it's in lots of jobs as well, and it's in lots of lives. Everything seems to be target driven rather than doing things because you thoroughly enjoy it. So we need to learn how to relax, and that doesn't mean just sitting and doing nothing. It means absorbing yourself in something that really helps you to feel calmer, more in the moment, and that brings you joy. And you should try and make that part of your routine, because it is very important for your health and for mitigating against stress. You need to try and get your natural circadian rhythm back. It's become disorientated in so many of us. I mentioned earlier about how we no longer see the sun rising and sun setting, that our perception of day and night, or light and darkness, is based mostly on artificial lights around us. So when our natural rhythm is really important, because that's how our hormones know how to be more or less active at different times of the day. And they all have different activities, these hormones, whether it's to help us eat, sleep, menstruate, reproduce, um, digest our food, whatever it is. These hormones are all very, very important, but it's going to be very difficult to allow our hormones to produce their vital functions if they don't know when they're supposed to perform them, because it varies from day to day, because you have no routine and because you don't have a rhythm to your day. Your brain is begging really for us to have a routine and to allow it to get into a rhythm of allowing it to produce the hormones required at different times of the day to do the different functions. So, and we're the only ones who can offer that routine and that rhythm to our brains and to our bodies. Modern living means that we get a lot more stressed about a lot more things a lot of the time, and our bodies forget what it feels like to have normal cortisol levels. Um, and when we have high cortisol levels over a very long time, it disrupts a lot of body functions. And I very much can speak from personal experience here, but depending on time, we might touch on that, but possibly not. Um, I will go on though to give you examples, and they come from the book The Stress Solution by Dr. Chatterjee. And basically, for every, basically, as I mentioned earlier, stress is good. We need stress. We need to help it because it allows us to deal with, priming ourselves for a difficult exam, um, beating the other team in a sport, whatever it is you're doing something to the best of your ability that requires a lot of physical exertion and mental execution. So stress is really important. And so I'm going to describe the things that happen when we're under stress and why they're good for us. But then I'm also going to go on to describe how, if you don't then get that response under control, it will long term, if the response stays high, how it will go on to damage you. In other words, the difference between a short healthy response and a long term unhealthy and dangerous consequence of that same response. So the first one is raised blood pressure. We need raised blood pressure in certain situations, because it helps us to transport more blood and thereby oxygen to our brain and to our muscles and to our organs. However, if you are exposed to chronic high blood pressure, if your blood pressure isn't settling down, then that will, if it becomes chronic, result in things like heart disease, stroke, and actually other diseases as well. Blood clotting, normally very important. If you're bleeding, you want your blood to clot. It helps to clean the wound and get it repaired and sealed before infection sets in. However, if you have a long-term issue with blood clotting, then it will increase your risk of having, again, things like stroke and deep venous thrombosis. Now, with stress, these are all the things, by the way, that happen normally when you have a stress response. Normally, when you have stress, you will increase your insulin resistance in the short term. And that means that your body, rather than storing the sugar that's coming into it actually keeps it in the bloodstream. So rather than the sugar going to your liver and your muscle cells, it stays in your blood, and that provides a great instant energy source for your brain and other parts of your body that need it for energy. But if you have blood sugar levels, they're rising all the time, and they're not able to get into your liver and your muscle cells because you're saying, no, I still need it because I'm still super stressed, then that the sugar levels go up, and then you're more likely to develop things like high sugar from diabetes, high blood pressure will also result, and also you can produce harmful types of cholesterol as well in your body. So insulin resistance, if it becomes chronic, can be very damaging to your health. Now, the body's resources when you're under stress release cortisol, and this helps you to deal with the immediate stress. And it's the expense of things like sex steroid hormones like estrogen and testosterone. So if you are under stress for a long time and you basically you're diverting resources to produce cortisol, then you're less likely to be producing those other important sex steroid hormones, which results in issues like lack of libido and menopausal symptoms as well. Now, the body's resources are directed away from digestion when you're under stress, because whilst you're running away from that tiger, you don't want to be digesting your dinner at the same time, so your digestion stops temporarily whilst you're dealing with a stressful situation. However, if the attention is diverted away from the digestive system too long because your stress levels are up a lot of the time, then you suffer from digestive complaints like constipation, bloating, indigestion, irritable bowel syndrome. So you're already starting to see that if you're under stress for prolonged periods of time, how many different systems are affected over time. And for different people, it will be different systems that are primarily affected depending on where your particular weakness is in your body. Now, small amounts of cortisol are important because they help to improve our brain function, which allows us to function better in a short, stressful situation like performing well in an exam. However, if you produce cortisol over a long period of time, it starts to kill nerve cells in the hippocampus, which was that brain's memory center, if you remember, and it will also increase the likelihood of developing Alzheimer's disease as well. So prolonged release of cortisol is not good for you as well. Now, the emotional brain being on a high attack, a high alert, that's important because it allows us to look out for threats, and it's a very good thing if you're in danger for your emotional brain to be fired up because it's thinking, yeah, I need to keep an eye out for whatever's going to come at me and make me feel unsafe. But if this becomes long term, if you're feeling that sense that you're unsafe, that you're constantly being attacked, even when there isn't an immediate source of that attacker present, then that will make you more prone to being anxious, and you'll start to worry about everything and danger, and you'll see danger even when danger isn't present. You'll be more jumpy, you'll be more hyper alert, you'll be more sensitive, and you'll feel it. Your heart rate will be constantly on the up and your breathing rate will be shallow. So again, short-term stress, good for you. Long-term stress, not good for you. Short-term inflammation happens when you have a stress response, and it's important because the immune system needs to fire up to deal with a threat. Like if you've been attacked and you've got a wound, and there's probably bugs that have got in through the wound, the immune system needs to be on all cylinders so that it can fight off those bugs that have entered your body. And that's a good thing, and it helps you to recover quickly and for your wound to heal up quickly. However, if that inflammation becomes chronic because you've had stress over a long time, then you will develop health conditions, particularly chronic long-term health diseases like type 2 diabetes, heart disease, and many causes of depression as well have been linked to long-term inflammation. So you can see it's so important to normalize your stress levels when you can, not to let them run away from you, to learn how to get that foot off the accelerator. Because if it gets stuck, the longer it gets stuck, the harder it is to learn how to put the brake back on. You almost become habituated to having your life in acceleration mode all the time, and it becomes extremely damaging, as I've identified with all the examples. It becomes extremely damaging to your body's health and your mental well-being. So to learn how to get your cortisol levels back to normal and to learn what it feels like, Do things that allow you to have protected time to really relax, because this will have positive effects on all your hormones in your body. It will improve, uh, uh, if you can improve your getting a good quality of sleep, it will help to reduce your weight as well. And by learning how to relax, it will also improve your ability to cope, to be more resilient, to have a more balanced outlook, to get less angry, less irritable, and to concentrate better. So I'm going to give you some examples to finish with of what you can do, real things you can do. I've mentioned about breathing techniques, slow breathing, deep breathing, and not just, and actually do it anyway, even if you don't feel you want to or need to, just do it, because I think many of you may be surprised how hard it is to breathe really deeply. If you haven't done it for a while, it doesn't come naturally to most of us. Most of us have, over the years, become shallow breathers, and it's good to relearn how to breathe right down to the bottom of your stomach, down to your diaphragm, rather than just breathing in this top sort of third of your chest, which a lot of us do. And by doing that, you're allowing yourself to get more oxygen in, and it's also helping to rest and relax your muscles. And often in people who've had strokes and other conditions, your muscles become very tense. For many of us who just spend days sitting a lot, our muscles become tense. So just being aware of your breathing, being able to deep breathe, will really help to oxygenate your body and relax your muscles and give you an incredible sense of wellness. So it's worth trying. Other examples include having a bath, playing music, singing, relaxing, with or without music, painting, dancing, reading a book, going for a walk, doing a spot of gardening. Be aware of your surroundings. Allow your senses to tune into nature, its sounds, its sights, its smells. It's really important to expose your body and brain to natural daylight as well. Get as much natural light as you can, and it doesn't matter if it's a cloudy day, a sunny day. Stepping outside, getting the light into the back of your eye will really help you later on in the day with sleep as well as helping to de-stress you. Try to wean yourself off excess use of devices, like always checking your phone, your tablet. Try device-free times in your day, especially in waking and at the end of the day. We spend an average of 3 hours and 16 minutes on our phones every day, and up to 40% of our speech time on average is spent informing others of our own experiences, which can become itself an addiction because it triggers a part in our brain which is an addiction center. And so the more you use your phone, the more you actually become addicted to it. So try these digital detox tips if you think that you're perhaps a victim of your digital devices. Don't start or end your day on your devices. Switch off push notifications. Unsubscribe from redundant email lists. Set your emails to refresh manually. Take work emails off your phone. Don't use your device at mealtimes. Try switching off your e-devices an hour, even 90 minutes before bedtime. And if you're working, disable your email box on Friday after work and don't enable it until Monday morning. So allow your weekends to be your weekends, if that's when you would normally have your time off. At the weekend, try at least a couple of 1 hour periods without your phone and just enjoy those special moments without feeling you have to kind of post about them or write about them or mention about them. Consider a gratitude journal. Or consider writing every day or several times a week all the things that you've done well, that have gone well for you that day, and the things that you're grateful for. It can be really simple things like realizing that you're not on your own, that you're not living on your own. This will raise your level of life satisfaction, and it will reduce your depression and your anxiety levels. It will also help to put your things in perspective. Consider a journal where you record your feelings and your thoughts. It will allow you to see the wood for the trees. It will allow you to validate which habits are proving useful and which situations or experiences are not. And it will allow you to see it in front of you and to be able to be more logical about it rather than trying to sort it all out in the moment. Practice daily stillness. It only has to be a few minutes. I've mentioned meditation and breathing, holding in for a few seconds, breathing in, holding it, and then breathing out. Also consider, if that's not for you, a colouring book for a few minutes, or sitting in silence, just aware of your feet on the floor and the air on your cheeks. And if you can, take your shoes and socks off. And especially if you've had stroke, and perhaps if you're somebody who normally has your weaker foot bound up in a shoe or a boot or an orthotic all day, try to have moments where you take your shoe off or your shoes off and have your bare skin against the floor, or even outside if you're sat outside. Let your feet touch and tickle the grass. It gives you such beautiful feedback, and it allows your feet to expand and really feel connected to the earth. And it's amazing how it will make you feel, just something as simple as doing that. And whilst you're doing that, just be aware of all the feelings, the sounds, the experiences that are around you, and sit there and just enjoy the moment. We don't always have to feel that we're filling every minute of our day with an activity. If you can, start your day with a few moments of mindful meditation, or if that's not for you, try some movement mindfulness where you try walking somewhere pleasant, and just concentrate on your movement and on what you can hear and see and feel. And the other thing you can do is trying some gentle stretches and breathing exercises in the morning. Or if morning's just no good for you, then any other time of the day. Even walking whilst aware of your surroundings will make you feel more alive and more in the present moment. So I think I'll stop there because I'm aware of time, and it's been a delight being here again this week, and I really hope that you found this of some use. I'll just have a quick look at my phone to see if there's any comments that require. I don't think there is. No, so with that, I shall say bye, and I'll look forward to seeing you next week, where we're talking about community and the importance of having a sense and a purpose to helping you get through this life and to feel better about yourself and about those around you as well. And please stay well and take care. Bye for now. Bye.